First of all, welcome to Aurora Health Alliance's Senior Circle meeting. Thanks for joining today. My name is Jo Glaviano. I'm the program coordinator with Aurora Health Alliance. Melissa Smith, our speaker for today. I will let you take it away, Melissa. Introduce yourself and go into our presentation and discussion.
All right, thank you, Jo. My name is Melissa Smith. I'm with Tri-County Health Department in our Community Health Promotion Division. And thank you all for an opportunity to share a little bit of information today about a project we've been working on. That's a new tool specifically to access data that's specific to older adults. And just a quick background history before I try to screen share and pull this up. We received a grant, just a 12-month capacity building grant at the health department last year from the National Alzheimer's Association and NACCHO, which is the National Association of City and County Health Officials. And the intent was to have us identify how, as a health department, we could support community efforts aimed at dementia. And in March, this group, many of you allowed me to come and ask you some questions focused on what you felt is most key for the public to know. And we were then charged with really finding our best contribution to the community and to our emerging health departments before we dissolve at the end of December. And so we thought that some aging-related dashboards would be a good foundation for new health departments to. One of the ways I think health departments can support aging work is by making the data that we have easily available and accessible. And so our epidemiology team identified all the data sources that they had access to. Where we could, we looked at age 55 plus, and that we could analyze by the end of the year. So, and they created these dashboards. It's data.tchd.org. Enter. And this takes us to a landing page with all of the dashboards that the health department has created and provides that are publicly available. And this is our most recent. And so we're going down to this icon called the Healthy Aging Initiative dashboard. And if you click on that, we'll come to another screen with two different websites. So with the counties moving to county level health departments, we chose to separate the data by county, but these two websites mirror each other. They're just, customized for each county. So we can go through Arapahoe County today as an example. And I'm just going to give kind of a quick run through of the layout. We won't spend a lot of time in the data. But it starts out with, there's really 4 sections. So we start with an introduction that is also a little bit of a disclaimer. So we want to be a single source of information. There are a lot of other good data sources for older adults, and we try to link to many of those in the dashboard. But some of the data sets are not large enough to make generalizations or to make specific conclusions. So the intent was really that we would have data to support conversations, really without getting stuck in the analysis of all that. So the next section is a table of contents, and there are 8 icons, and we'll come back to one of these and go through as an example, but 8 icons that categorize the data. So hopefully helping people not have to scroll through a whole bunch of stuff that they don't need until they can get to what they are most interested in. And then the third section is community resources for aging. These are the experts. One of the things that we heard from you, and there's just a lot that really just needs to be disseminated more broadly. And so we felt like one of the things we could do as a health department is simply try to promote the local assets and expertise that we have. So these are some county specific and some state specific. We've got research institutions, we've got Dr. Cog and their network of care. So hopefully you'll see lots of familiar names in there. And then the last section is community facts. We have the most recent community health assessment for each county and the most recently updated county level fact sheets. In this grant was Alzheimer's and dementia specific. In Arapahoe County, Alzheimer's disease was the 4th leading cause of death the last time this was updated, and I believe it was the 6th leading cause of death in Adams County. So again, just a goal of trying to make that easily accessible. But as a quick example, one of the things that our epidemiology team was able to do was pull hospitalization data. So if we look at Alzheimer's disease in this icon, there's a summary describing the data and where it came from and some of the highlights. And then we looked at hospitalization where Alzheimer's or a dementia or a cognitive impairment diagnosis was part of that person's discharge code. So not necessarily the reason that they were admitted to the hospital, but it was part of the description about that patient. Oh, and it looks like I lost my age labels up here. So they broke that out by age group. So this first column on the left is actually age 55 to 64. This next one is 65 to 74, 75 to 84, and 85 plus. And this is data over a 4-year span. But what I think is an example of importance for having conversations is we don't often talk a lot about early diagnosis or early onset dementia, but we see in the 55 to 64 age group that we have people in these graphs. And so it is a real thing, and it's something that affects our community. So that would be an example of where we wouldn't be able to make recommendations about this, but we can certainly make a case for this is something that we might need to talk more about. And maybe a health department can assist with providing more data. So that is just an example. And then one more quick thing, if I can find, let's see. This livability index icon, this is a fun tool and something that we felt was worthy to include again as another data source. The AARP developed this. It's the first nationwide online tool that scores every neighborhood against more than 60 indicators across 7 different categories to assess overall livability. And it was created because research has shown that most people would like to age in their own homes and communities, but many communities aren't really structured to support this. And so it's kind of fun. If you enter an address, it'll give you a score for that neighborhood. If you enter a city, it will give you a score for all neighborhoods in that city. If that's something you're welcome to browse if you'd like to. But I think it's another example when we talk about livability of communities, then it links back to organizations like Dementia Friendly Denver, which really are around improving quality of life for people with dementia and families and caregivers. So that I think is my spiel, and I'm happy to take any questions or feedback. There are links at the bottom of each page if you'd like to provide written feedback or have a question. And now I'm looking to figure out how to find our faces again. I think we're here. Yay. And someplace I can stop screen share. Oh, I see a question, Janine.
It's Jeannie,
Jeannie,
and yes, I do. I've got 2 questions actually. Go up to the slide before the one that's on the screen. You just talked right there. Come down a little bit. You just talked about age-friendly communities.
Mm-hmm.
Yeah, and the Aurora Commission for Older Adults is in the process of conducting a needs assessment. We've begun our work with the scope of work, and one of the things that we were looking at was age-friendly communities. Surprisingly enough, even though it's the 3rd largest city in this state, Aurora is not participating in that AARP community thing. So my question is, does this include only those who are participating with AARP's program? Can you scroll down just one more?
So as I understand it, this
Yeah, right there.
livability index.
Livability index.
So this is, they pull from a lot of different data sources, census tract, different community survey data. So you should be able to type in Aurora. Let's try it and see what we get. Let's see here. So, and it's fairly general information, so it will pull up what is publicly available.
Adams.
Now this, because this would include all neighborhoods in Aurora and is showing Aurora as Adams County, which I believe is because the majority of Aurora population is physically based in Adams County. But you could pull up, you know, the general demographic kind of data points. And then if you click on the sources, it takes you to where they got that information from. So it may be a resource in pulling some data. I'm just curious if I did like an Aurora zip code.
Do 80017.
Yeah, I put my zip code in too,
okay.
and it worked out.
Yeah. I
So
think
80017 then falls in Arapahoe County.
right.
So,
And what's
so that's
the
a great
website?
question. This is a
Can
fairly
you
new.
post the website that you're using right there? Can you post that in the chat and I can copy it?
Yes.
Thank you.
Well. Here we go. So that is that one I just put takes you to the Tri-County websites. And this is the AARP tool.
Okay. Thank you so much.
Yeah, thank you.
The other question that I had was, what organization, company, or otherwise helped you develop this analysis? Was it all done internally or did you use outside resources?
So this particular tool, AARP, is their tool that's nationally available, but the dashboards were all developed internally by our epidemiology staff, and they use a software platform called Esri, that I think SRI, I don't know what that stands for, but it's it allows for the GIS mapping, and it allows them to build custom websites and then pull in from other data sources. They could explain it with much greater detail and accuracy, but our epidemiology staff are the ones who built the website and analyzed the data and then plugged it in.
Thank you so much. All right.
Thanks, Melissa. There was a question in the chat and that's asking if you're transitioning to a different or new health department. And just adding on to that, my question is, will the health departments then just then link to these dashboards on their own once the health departments have split apart starting the beginning of next year?
Yeah, that is our hope. And that was, so the epidemiology staff, many of them who worked on this have accepted employment with newer health departments. And so we know that what I want to say about this group, they were really fabulous. You know, we're in the process of wind down and counties are in the process of startup. And so everybody's got 2 jobs, and we hit up this epi team with this really kind of muddy ask. It's like, hey, we'd really like it. And they all said yes. They were all just, and they didn't have to, they had the option to say no. So I think that's really just a great example of how committed people are to this work, even if it's not necessarily part of their day-to-day job description. And so yeah, so that part was great. But so yeah, they will make available to each of the new county health departments all the information, the data, the templates, in hopes that they'll be able to adopt or adapt those. Now, whether they'll look exactly the same or whether they might choose to display it differently, that will be up to them. But we've heard from both that they're very interested in doing as much as they can with it. But until the end of December, at least, it will be available on this website. Well, thanks so much.
Yeah, thanks,
hope-
Melissa. Thank you all so much for being here and for your time. We will see you in the new year. And please stay safe and healthy, and look forward to seeing you and connecting. Thank you all so much.
Happy Thanksgiving, everybody.
Thanks so much.
Yes. Thank you.